An official with the European Medicines Agency is now saying there is a link between the AstraZeneca COVID-19 vaccine and rare blood clots in the brain. However, it is unclear what exactly that connection is. Dr. Bob Lahita joins us now on Skype. He is the director for Autoimmune and Rheumatic Diseases at St. Joseph Health and a professor of medicine at Rutgers and New York Medical College. Dr. Lahita, thank you so much for your time today. Great to see you. The European Medicines Agency is saying that it will have more on these findings once the review is finalized sometime this week. That said, they do say the benefits of the vaccine still outweigh the risks. Let's talk more about that.
Yes, well, clotting is a very common process. There are people who naturally clot when their immune systems are activated. In fact, we have a condition that is related to clotting, which happens in very few people. Fortunately, it's very rare, but it does happen in the autoimmune diseases, for example. Now, if you're activating the immune system by giving a patient a vaccine, which revs up immunity, those few people in the population will probably form antibodies to clotting factors, and they will clot. And that we see it naturally without vaccines in some patients that come to see us in our clinics. And this is a very, very unusual condition, but it certainly can happen. I would agree that getting the vaccine far outweighs the risks of having these clots form, because if these clots are detected, they can be controlled.
As we know, AstraZeneca's vaccine really isn't the only one in which adverse reactions, some even severe, have been reported. And while we know these reactions really are rare, do we know why they're occurring? Is it the vaccines or is it the person's immune system? Do we know?
The person's immune system, I suspect. We really don't know, but it's being investigated by my colleagues in Europe, and we suspect it's the immune system. It's not the person's, it's not the vaccine at all. When, you know, and I have a group of post-COVID patients that I see called the long haulers, and they have all sorts of things, ulcers in their mouths, headaches, chronic headaches, of course, lack of smell and taste that go forever and ever. And clotting of the blood, clotting and low platelets, for example, which is associated with this blood clotting problem, are seen periodically in rare individuals. So this is a result of the vaccine. It's not the virus that's doing this.
One of the things we did mention earlier today, I'm sure you heard about this, the White House is saying that 100% of adults will be eligible for the vaccine by April 19th. That's really just around the corner. How important is that when it comes to stopping this pandemic, especially as we're seeing these new variants, the virus emerge?
Well, you know, we really want to achieve herd immunity, which requires that 70% of us or more are either infected with the virus or receive the vaccine. I strongly encourage everyone to receive the vaccine. Now, you and I have both heard of people who get on the web and on phone lines and trying to get inoculated with these vaccines. And they're often told, well, you don't fit this group or that group. If you're not a school teacher or a doctor or a nurse, you just can't get it yet. My feeling is that a lot of places go leaving empty chairs and people standing around with syringes loaded with the vaccine, ready to give them to people, but there are no people to give them to. So I think the important thing is that everybody should be opened up to getting these, from young people in their teens. And, you know, there's a lot of data now we have from 12 and up that show that it's exceedingly effective in young people. And there are a series of trials in littler people from 6 months to 12 years going on right now. Everybody should be immunized. Once people are immunized or they've had the infection, God forbid, if they've had the infection and we have people who are immunized, we'll have herd immunity. Once we get to herd immunity, we're all free to go. You know, we can doff the masks and no longer worry about going to social and public functions, going to church, for example, attending theaters, etc.
Yeah, looking forward to that for sure. Dr. Lahita, thank you so much. We always appreciate you coming on.
Thank you very much.